Thank you, Nosihle. Young people in Zambia have fears that other key health needs in the country may be affected as the country focuses on the advent of coronavirus, or otherwise known as COVID-19. Our Zambian correspondent based in the capital Lusaka, Arthur Scopo, shares the details.
Fears are rising about from the impact of the novel coronavirus, or otherwise known as COVID-19, on the health sector in Zambia. The concerns are from a number of young people in the country whose work focus on health matters with a pointed inclination to sexual and reproductive health and rights, or SRHR. SRHR is one component that determines the wellness of any society, which further gives a projection of population and social growth. As the cases of COVID-19 increase in the world and Zambia having a share of 29 confirmed so far, since the pandemic hit Africa from China in Asia where it began from, these journalists caught up with young people that have raised concerns over the virus. Victor Sinyangwe, an activist who is also specialized in monitoring and evaluation around health matters in non-governmental organizations, with focus on HIV/AIDS, tuberculosis and family planning, says there is need to equally deal with both the emergency of COVID-19 and other health concerns such as sexual, reproductive health and rights. He notes that it is essential to re-evaluate and repackage the health sector to make it more friendly to young people, especially where matters of sexual reproductive health are concerned.
Imagine you're asking youth to quarantine and they don't have access to sexual and reproductive health in this scenario. You're creating a situation where we're trying to prevent COVID-19, but we may be escalating the other issues to do with HIV/AIDS and infections on the other end. That is where we need to start. We need to go back. And this should not be only for this period. This should be for now and going forward. We need to repackage the health sector, the health sector's access to this based on certain groups of people.
Mwenya Chiti, the executive director of Pakama Africa, an organization that deals with sexual, reproductive health and rights, pours out her fears, stating that COVID-19 is likely to impact negatively on SRHR and hit hard the young people. She adds, saying that services for young people should not be forgotten, even as the country and the entire world focuses on COVID-19 and its challenges.
It could have negative impact on the progress we have made as a country with regards to sexual and reproductive health and rights programs. Hospital staff are overwhelmed with the victims of COVID-19, such that sexual and reproductive health and rights service provision seems trivial at the moment, thereby causing scarcity in clinicians.
Meanwhile, Georgina Wabezere, another sexual and reproductive health and rights advocate, says COVID-19 will see an impact on the supply of services and medication to the health centers, thereby affecting beneficiaries, especially the young population.
At the health level, we may see shortages of medications such as contraceptives, ARVs, and antibiotics to treat STIs. All this will be due to disruption in supply chains overall.
COVID-19 may not just hit the health sector from the medication and services angles, but nutrition-wise too. Joe Musonda is Save the Children Country Director and reveals that due to the stoppage in the feeding programs in schools that her organization implements, many children from vulnerable families that depend on the school meals may suffer from malnutrition. She outlines that medical personnel may have to deal with malnutrition cases later that will be brought about due to the COVID-19 advent.
Those children often rely on schools to also provide a meal in the day. Sometimes it may be the only meal. Obviously that's important for their own health and nutrition. So if they're not attending school, they're not receiving that meal, where are they getting that food from? It leaves them more marginalised. With the closure of schools, the school feeding programme that we've been implementing clearly has stopped. So now we have the challenge of working out how to respond to those children's health and nutrition needs.
But the Zambian government, through Health Minister Chitalo Chilufya, says all sectors of the health front will be treated equally, save for COVID-19, which has only been given a priority due to its urgency and graveness. Arthur Scopo reporting for Channel Africa in Lusaka, Zambia.
SABC News, independent and impartial.
From an African perspective.